In cancer care, different types of doctors, including medical oncologists, surgeons, and radiation oncologists, often work together to create an overall treatment plan that may combine different types of treatments to treat the cancer. Treatment options and recommendations depend on several factors, including the type and stage of cancer, possible side effects, and the patient's preferences and overall health. Treatment depends on the stage. Some types of prostate cancer grow slowly, whilst others are very aggressive. Treatments are generally used one at a time, but in some cases, they may be combined. 1. Observation or active surveillance for prostate cancer. Prostate cancer treatments may seriously affect a person's quality of life. These treatments can cause side effects such as erectile dysfunction, which is when someone is unable to get and maintain an erection, and incontinence, which is when a person cannot control their urine flow or bowel function. In addition, many prostate cancer grow slowly and cause no symptoms or problems. For this reason, many people may consider delaying cancer treatment rather than starting treatment right away. This is called active surveillance. During active surveillance, the cancer is closely monitored for signs that it is worsening. Prostate biopsies and imaging tests may be done every 1 to 3 years. If the cancer is found to be worsening, treatment will begin. 2. Radical prostatectomy. A radical prostatectomy is the surgical removal of the entire prostate and the seminal vesicles. Lymph nodes in the pelvic area may also be removed. This operation has the risk of affecting sexual function. Nerve-sparing surgery, when possible, increases the chance that the patient can maintain sexual function after surgery by avoiding surgical damage to the nerves that allow erections and orgasm to occur. Orgasm can occur even if some nerves are cut because these are separate processes. Urinary incontinence is also a possible side effect of radical prostatectomy. To help resume normal sexual function, drugs, perineal implants, or injections may be recommended. Sometimes, another surgery can fix urinary incontinence. 3. Robotic or laparoscopic prostatectomy. This type of surgery is less invasive than a radical prostatectomy and may shorten recovery time. A camera and instruments are inserted through small keyhole incisions in the patient's abdomen. The surgeon then directs the robotic instrument to remove the prostate gland. In general, robotic prostatectomy causes less bleeding and less pain, but the sexual and urinary side effects are similar to those of a radical prostatectomy. Talk with your doctor about whether your treatment center offers this procedure and how it compares with the results of the radical prostatectomy. 4. External beam radiation therapy. External beam radiation therapy is the most common type of radiation treatment. The radiation oncologist uses a machine located outside the body to focus a beam of X-rays on the area with the cancer. One method of external beam radiation therapy used to treat prostate cancer is called hypofractionated radiation therapy. This is when a person receives a higher daily dose of radiation therapy given over a shorter period instead of lower doses given over a longer period. Extreme hypofraction radiation therapy is when the entire treatment is delivered in 5 or fewer treatments. Moderate hypofraction radiation therapy regimens typically include 20 to 28 treatments. This is also called stereotactic body radiation therapy or stereotactic ablative radiation therapy. 5. Brachytherapy or internal radiation therapy. Brachytherapy or internal radiation therapy is the insertion of a radioactive source directly into the prostate. These sources, called seeds, give off radiation just around the area where they are inserted and may be left for a short time or for a longer time. Low dose rate seeds are left in the prostate permanently and work for up to 1 year after they are inserted. However, how long they work depends on the source of radiation. High dose rate brachytherapy is usually left in the body for less than 30 minutes, but it may need to be given more than once. 6. Intensity-modulated radiation therapy. Intensity-modulated radiation therapy is a type of external beam radiation therapy that uses CT scans to form a 3D picture of the prostate before treatment. A computer uses this information about the size, shape, and location of the prostate cancer to determine how much radiation is needed to destroy it. With intensity-modulated radiation therapy, high doses of radiation can be directed at the prostate without increasing the risk of damaging nearby organs. 7. Proton therapy. Proton therapy, also called proton beam therapy, is a type of external beam radiation therapy that uses protons rather than X-rays. At high energy, protons can destroy cancer cells. Current research has not shown that proton therapy provides any more benefit to people with prostate cancer than traditional radiation therapy. It can also be more expensive. 8. Cryotherapy. Cryosurgery or cryotherapy or cryoablation involves freezing cancer cells with a metal probe inserted through a small incision in the area between the rectum and the scrotum. That is the skin sac that contains the testicles. It is not an established therapy or standard of care to treat newly diagnosed prostate cancer. Cryosurgery or cryotherapy has not been compared with radical prostatectomy or radiation therapy, so doctors do not know if it is a comparable treatment option. Its effects on urinary and sexual function are also not well known. 9. High intensity focused ultrasound. High intensity focused ultrasound is a heat-based type of therapy. During high-intensity focused ultrasound treatment, an ultrasound probe is inserted into the rectum, and then sound waves are directed at parts of the prostate gland with cancer. This treatment is designed to destroy cancer cells while limiting damage to the rest of the prostate gland. High-intensity focused ultrasound may be an attractive option for some people, but knowing who may benefit most from this treatment is still unknown. High-intensity focused ultrasound should only be performed by a specialist with a lot of expertise. 10. Hormone therapy. Because prostate cancer growth is driven by male sex hormones called androgens, lowering levels of these hormones can help slow the growth of the cancer. The most common androgen is testosterone. Hormonal therapy is used to lower testosterone levels in the body, either by surgically removing the testicles, known as surgical castration, or by taking drugs that turn off the function of the testicles, called medical castration. Another way to stop testosterone from driving the growth of prostate cancer is to treat it with a type of medication called an androgen axis inhibitor. These medications can stop the body from making testosterone or stop testosterone from working. Treatment with hormonal therapy is used to treat prostate cancer in many different situations, including localized, locally advanced, metastatic prostate cancer, as well as rising PSA level after surgery and/or radiation therapy for localized prostate cancer. 11. Chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells, usually by keeping the cancer cells from growing, dividing and making more cells. Chemotherapy may help those with advanced or castration-resistant prostate cancer and those with newly diagnosed or castration-sensitive metastatic prostate cancer. A chemotherapy regimen or schedule usually consists of a specific number of cycles given over a set period of time. 12. Immunotherapy. Immunotherapy, also called biologic therapy, is designed to boost the body's natural defenses to fight the cancer. It uses materials made either by the body or in a laboratory to improve, target, or restore immune system function. For some people with castration-resistant metastatic prostate cancer, who have no or very few cancer symptoms and generally have not had chemotherapy, with Sipuleucel T may be an option. Sipuleucel T is adapted for each patient. Before treatment, blood is removed from the patient in a process called leukapheresis. Special immune cells are separated from the patient's blood, modified in a laboratory, and then put back into the patient. At this point, patient's immune system may recognize and destroy prostate cancer cells. When this treatment is used, it is difficult to know if the treatment is working to treat the cancer because treatment with Sipuleucel T does not lead to lower PSA levels, shrinking of the tumor, or keeping the cancer from getting worse. However, results from clinical trials have shown that treatment with Sipuleucel T can lengthen lives by about 4 months in people with metastatic castration-resistant prostate cancer with few or no symptoms. 13. Targeted therapy. Targeted therapy is a treatment that targets the cancer-specific genes, proteins, or the tissue environment that contributes to cancer growth and survival. This type of treatment blocks the growth and spread of cancer cells and limits damage to healthy cells. Not all tumors have the same targets. To find the most effective treatment, your doctor may run tests to identify the genes, proteins, and other factors in your tumor. This helps doctors better match each patient with the most effective treatment whenever possible. In addition, research studies continue to find out more about specific molecular targets and new treatments directed at them. Recovery from cancer is not always possible. If the cancer cannot be cured or controlled, the disease may be called advanced or terminal. This diagnosis is stressful, and for some people, advanced cancer may be difficult to discuss. However, it is important to have open and honest conversations with your healthcare team to express your feelings, preferences, and concerns. The healthcare team has special skills, experience, and knowledge to support patients and their families, and there to help. Making sure a person is physically comfortable, free from pain, and emotionally supported is extremely important.